Buon pomeriggio a tutti, siamo a Forum Sanità 2024 in compagnia di John Rayner, Senior Director Healthcare Information and Management System Society. Good afternoon, Mr. John Rayner.
Good afternoon.
L'intelligenza artificiale è destinata a rivoluzionare il sistema sanitario, con impatti sui processi e percorsi di cura. Quale ritiene sia il principale cambiamento?
Okay, so I think there are a number of issues that we have to consider with artificial intelligence and how we might use it in healthcare. One of the first concerns, I think, is from patients, clinicians and the general public, and that's about the whole security and confidentiality aspect of using these large amounts of data within artificial intelligence algorithms. So the first point of consideration is to ensure that we have good security. The second point is governance. People want to see regulation. They want to understand how the artificial intelligence algorithm will be used and what the desired effect is. And I guess when we think about governance, we would also think about bias. There is bias in healthcare now. So the way people are treated is very much dependent on the evidence, but also on the way clinicians were trained, on any particular view or inclination that the clinician might have. And there are vulnerable groups, people who come from specific geographical locations or certain socio-economic groups are vulnerable. And as such, we must make sure that any bias contained within an artificial intelligence algorithm doesn't widen equity. It doesn't make healthcare less accessible than it already is. Two more things, I guess. The first one is that the artificial intelligence software or algorithm must be integrated into current information systems. It cannot be a standalone entity. And perhaps the final and most important point is clinical acceptance and clinical training. We have to train our doctors and nurses in a way that artificial intelligence becomes part and parcel of their day-to-day business. It's yet another tool that they have at their disposal. And getting their acceptance, getting their understanding, getting a level of confidence within artificial intelligence right across the clinical community is going to take some effort.
In che modo le organizzazioni sanitarie possono bilanciare innovazione tecnologica con rispetto dei diritti universali, soprattutto in contesti con risorse limitate, off limits?
Yeah, so first of all, providing universal healthcare in low to middle income countries is a challenge. You balance that off with the cost of technical innovation. You create a bit of a barrier. You can create a logjam, and to some extent, we have to be even more focused on what that money is going to be spent on, how it's going to improve outcomes, and the benefit that it might have. So all over the world, I see healthcare spend often wasted on technology. And those could be technologies that are simply nice to have. They are rarely technologies that are aligned with a particular solution. So when you're buying something with a budget that is already stretched in a country that doesn't provide universal healthcare, you've got to be really sure that you are tendering for a specific outcome. You have to fully understand the problem and know how technology will solve that problem. And quite often, it isn't an expensive technology. It can often be a simple technology that has been designed for a specific solution, and the benefit it has in that environment becomes quite considerable.
Thank you.
Thank you very much.
Thank you very much.
Bye-bye.